morning, good afternoon, wherever you are. It's 4 o'clock in Poland at the moment. So thank you for having me here. Thank you for your invitation. I will share my presentation with you. I hope it works. So my topic is how to improve the communication between a doctor and a patient and why is it important. And please pay attention that I am not talking about the communication as such, because we all know that it is really very important and why, but how we can improve communication. So before I will go to the point, please let me introduce myself. I am Iga Rawicka. I am patient advocate. I am the president of EuropaColon Polska Foundation. I am former board of member and chair of Digestive Cancers Europe. I am also a World Pancreatic Cancer Day committee member, a GI Cancers Alliance board member. This is US organization. I am also a clinical psycho-oncologist with a post-degree in clinical psycho-oncology and PR expert. EuropaColon Poland is a member of international organizations such as Digestive Cancers Europe, Colon Cancer Association, GI Cancers Alliance, also Cancer Patients Europe, and some of pancreatic cancer organization worldwide. So communication between a doctor and a patient. So as you can see in this picture, there are only two people, so a doctor and a patient, and they can understand each other better or worse. It depends on many aspects. But it's not only patient and doctor who communicate. There are also some other people, like, for example, communication between a doctor and a staff member. But when we are talking about treating the patients in MDT, especially we call it in Poland colorectal cancer units. So there are many people who interact with each other and they communicate among others. So we were thinking how we may improve the communication between them. So you will see that it started not actually from the communication, but from the other aspect, because at the moment we are talking about lots about burning out of the doctors, of any staff, especially in hospitals. Or wherever else, but especially in hospitals, because we are talking about this topic. So I'm sorry if you okay, is it better now? Because I think that you could, okay, fine. So just let me know if you can see the next slide if I go further. So we decided to assess how the situation in one of the colorectal cancer units in Poland exists, and what is the level of the communication, but also what is the level of burnout of the staff at colorectal cancer unit. So we decided to divide it in three parts. The first one, it was the survey, which was done by 26 members of this exact colorectal cancer unit. There were 15 questions in this survey. I will not go into the details because there is not much time for it, but the next part was there were interviews with 8 members of colorectal cancer unit. There were among them clinicians, like clinical oncologists, like surgeon, like psycho-oncologist, dietitian, also nurses. So it was not only they were not only the doctors, but also the rest of the staff, who is also really very important. And we had 20 questions. They all responded to all those questions. And the third part was one workshop, which was run with all the participants of the survey. So firstly, we prepared the recommendations for the assessed center. So exactly for this center where we were in the northeast of Poland, which is really a very good center, quite well known. But of course, everywhere you can improve everything, especially communication or this kind of soft skills, I would say. And then, based on what we've done, we prepared some recommendations. Finally, we received 17 recommendations. They are not here, all of them. But some of them, more of them were dedicated to see how to strengthen the colorectal cancer unit team. For example, how to strengthen the mental condition of the staff, how to implement some procedures so they can improve their well-being, how to reduce staff turnover, because also for them it appeared that reducing staff or turnover was a problem in communication also. So finally, when we prepared all those recommendations, and if we are talking about the scale, in Poland there are 48 colorectal cancer units, but this means that those units have the financial contract with NHF. So it doesn't mean that there are no other multidisciplinary team in colorectal cancer treatments in other oncology centers, but they have the special agreement with NHF, and there are special requirements they have to meet. So it's not so easy to be colorectal cancer unit in Poland. So some of these recommendations referred strictly to communications. And for example, building positive relationships within the colorectal cancer unit team. An integrated team is more, is more dedicated or more sensitive when disturbing of the symptoms in the behavior of its members, which in turn may for faster and more effective crisis intervention by a psycho-oncologist working with members of CCU team, or the mental well-being of individual employees, effective communication and good relationships within the therapeutical allow for more effective work. But what was the most important for us was to increase motivation and improve communication skills in colorectal cancer unit. And therefore, it goes the second part of this presentation, that we prepared the training for colorectal cancer units. We called it good relationship between MDT and the patients. It is 5 hours of e-learning, plus, of course, certificate, because there is a kind of certification at the end of this workshop and course and communication workshop. So they could run it wherever they wanted. They could stop it. They could come back and continue. We divided it into some some parts like communication, some individual visit scheme, burnout syndrome, communication in MDT, patients, family, cancer patients, patient pathway in the CCU, and palliative patients. And in each panel, there was, like here, you have the first panel, it's communication. So we, apart from the fact that there were some lasting educational materials with also some videos, and separately it was done for the doctors and separately for the nurses, including the staff which who cannot prescribe the drugs, like psycho-oncologists or dietitians, nurses, etc. So we also encouraged them to try, for example, to speak slower, to speak easier language for understanding for the patients, to check if the patient understood what somebody said, to look into eyes of the patient, etc., etc. So if they couldn't do this before the workshop, they were suggested to at least behave in like 4 or 5 bullet points what they can improve in order to have better understanding and better communication with the patient. So actually, we after all this process lasted for 2 years. So now we are just finishing the last colorectal cancer unit. And there were 4 of them finally, where we implemented our communication workshop and communication training. So it was all in total 120 experts, meaning, as I mentioned, the doctors and also the rest of the staff like nurses and dietitians or psycho-oncologists. So there are somewhere in Poland, some in south, in north, in the middle of Poland, but only 4 of them for the moment. We hope that maybe in the future we will be able to do it in other centers. But what I would like to tell you with this final conclusion and takeaway message, that proper communication between MDT and the patient ensures the success of effective therapy. So this is how we did it in Poland within EuropaColon Poland. It was our initiatives, our idea, and with some support of our sponsors, we could really run this kind of project. And this is all from me. If you have any questions, please go ahead, and you can here have my contact details.
Thanks a lot, Iga. Indeed, very, very important topic. I just have one quick question for you, because it's 21st century, so all is about technology, AI. What role does technology play in enhancing communication between doctors and patients? What do you think? Are you implementing anything related to technology?
Well, we have not implemented any this kind of tools so far, but of course we probably need to consider it. But to be honest, recently I tried to write a press release with the use of AI, and it really was not good enough, at least for me. So I wouldn't dare to share it with the journalists, for example, because it was. It was not deep enough. It was not the correct. It didn't give me any new. In fact, I did it in colorectal cancer, so so it was quite interesting. But definitely, any kind of mobile, I would say, equipments or solutions in the future probably would help, but we can never replace a human being. And even at that moment, human being needs to coordinate it, because If we lose this personal touch, it is not good. So whatever we can use good from these solutions, it's good to have. But let's not forget that we are human beings and we need to talk to other human beings.
I see. I want also to hear our colleagues from USA, because I know that in the USA, patients, they have access to their medical records. Even they can see the, let's say, results of their tests before seeing their doctors. So how this aspect impacts the communication between doctors and patients? Is it better or worse? How it works? I'm curious.
Yeah, so when similar, but I guess a real-time use of AI or artificial intelligence that we've actually implemented in our clinic, and there are other institutions besides City of Hope that it's also doing it. So, I'm a busy clinician alongside doing research, so I see patients at the same time. Documentation is critical. So we have the Microsoft's and Dragon's collaboration, the DAX tool, and all I do is take my phone and ask the patient that, can I have this tool listen in on our conversation as we speak normally? So I don't have to do anything differently, but you have this AI tool listening in on the conversation between the patient, the caregiver, the aspects of multidisciplinary team. It's able to decipher who's who. Is it the patient's daughter who's talking? And it knows that we're talking about colorectal cancer. So if I'm talking about drugs, it is summarizing things in real time. So, indirectly, it's helping with communication because, to Iga's point about multi-D, we have real-time surgeons, and colorectal is a very multidisciplinary care, from radiation oncology, surgical oncology, colorectal surgery. A patient, let's say, with rectal cancer, liver metastases, ends up seeing like 4 to 5 different providers. So having hours of time saved by having real-time documentation using AI, I can tell you I become a huge fan of this, and I can't imagine a visit now without using this AI tool because it's just I know there are discrepant opinions about it, but I'm at least sold on this particular utility of the AI tool for my patients with colorectal cancer.
I think that's a great practice, and it should be shared with the rest of the world, and the global cancer movement will
There
help
was
with
a
that.
trial recently published last week, and again, it was a primary care physician cohort. And again, some of the
Mhm.
things that it helps with are not necessarily tangible. I think you have to be smart about what outcomes are you trying to improve. Is it the quality of life of the physician? Is it, to your point, better communication? Is it more effective and succinct and accurate communication? It's also a good reminder for the patient and the doctor as to what we talked about. Did we talk about a refill of a medication that I forgot to send, but it's a good reminder for me to, okay, send it. And also it shows patient real time that we did talk about this because as Iga pointed out, there's a lot of information being thrown at a patient who just gets diagnosed with, let's say, colorectal cancer. And then you see multidisciplinary conversations happening. There's so many communications that are happening in silos. So, this could really help streamline communication in real time as opposed to a documentation of a note that happens, days or sometimes even, for busy folks where it lags behind. It can really help improve care in ways that, I don't think can be tangibly measured, the impact of.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.